Thanks for inviting me to share what I'm focused on and working on right now, which is actually the impending budget cuts to Medicaid and the massive impact it's going to have on all Americans, not just those who are currently receiving health care through Medicaid. I expect that many of the people here today already know a lot about what's going on as it pertains to threats to Medicaid, but let me share a bit more context just to be sure we're all on the same page. Medicaid cuts are coming. It's not official yet, and specifics of the cuts have yet to be determined, but funding and grant cuts will happen. The grant cuts are already happening. And my view, and that of some others that I coordinate with, is that just waiting for this inevitable shoe to drop is really irresponsible, as well as buying into a powerless victim mentality. Medicaid and CHIP, which is also at risk for cuts, cover healthcare for millions of Americans and not just those below the poverty line. For example, Medicaid covers 63% of all nursing home residents. And CHIP, which is the Children's Health Insurance Program, provides low-cost health coverage to children in families that earn too much money to qualify for Medicaid, but don't earn enough to really be able to provide the kind of health care coverage that their children require. So one of the more likely scenarios for these cuts to Medicaid funding is that the federal government will reduce its share of the funding of Medicaid expansion. Medicaid expansion, for those of you who may not be as familiar with it, began in 2014 under the ACA and today covers around 25 million people in the US, including adults earning up to 138% of the federal poverty level. So the expectation is that rather than simply ending the program, it's more likely that Congress will reduce its share of funding under Medicaid expansion from currently what its share is, which is 90%, to match the funding share for all other Medicaid beneficiaries, which across the country probably averages closer to 50%. And so the states will be left to decide how to make up that shortfall. Well, that likely means many people who are currently covered and qualify for Medicaid under Medicaid expansion will no longer be covered.